Question 1. A licensed practical nurse, LPN, is assisting with the admission of an older adult client diagnosed with heart failure. Which finding during the initial assessment requires immediate reporting to the registered nurse, RN? A. Client reports occasional mild ankle swelling at the end of the day. B. Client's blood pressure is 138/86 mmHg. C. Client states they sometimes feel short of breath when walking up a flight of stairs. D. Client has crackles audible in bilateral lung bases and reports increased shortness of breath at rest. Answer: D. Client has crackles audible in bilateral lung bases and reports increased shortness of breath at rest. This question tests your ability to identify urgent findings in a client with heart failure, a core concept in coordinated care. The keywords immediate reporting indicate a need for quick action. Crackles in the lungs and shortness of breath at rest are signs of acute pulmonary congestion, which suggests worsening heart failure and can quickly become a life-threatening emergency, requiring prompt intervention from the RN. While ankle swelling, elevated blood pressure, and exertional dyspnea are significant findings in heart failure, they do not indicate the same level of acute respiratory distress as crackles at rest, which signals fluid accumulation in the lungs. Always prioritize findings that indicate immediate threats to airway, breathing, or circulation. Question 2. The LPN is preparing to administer an oral medication to a client. Which action is the most appropriate first step? A. Check the client's wristband against the medication administration record, MAR. B. Document the medication administration in the client's chart. C. Explain the medication's purpose and side effects to the client. D. Assess the client's ability to swallow. Answer: A. Check the client's wristband against the medication administration record, MAR. This question assesses your knowledge of medication administration safety, a fundamental nursing responsibility. The keyword first step guides you to the initial and most critical action in the medication administration process. Before anything else, the LPN must verify the right client by comparing the client's identification band with the MAR to prevent medication errors, which is part of the 5 rights of medication administration. While client education, assessing swallowing, and documentation are crucial, they occur after initial client identification and before or after actual administration. Always remember, client safety through proper identification is paramount before touching any medication. Question 3. An LPN is caring for a client who is NPO for a surgical procedure scheduled for tomorrow morning. The client requests a glass of water because they are thirsty. What is the most appropriate response by the LPN? A. I will get you a small cup of water. B. You can have ice chips, but no water. C. I understand you're thirsty, but you cannot have anything by mouth before surgery. D. I will check with the surgeon to see if you can have water. Answer: C. I understand you're thirsty, but you cannot have anything by mouth before surgery. This question evaluates your understanding of NPO status and therapeutic communication in a coordinated care scenario. The key phrase NPO for a surgical procedure means nothing by mouth, which is a critical safety measure to prevent aspiration during anesthesia. Directly stating the restriction while acknowledging the client's discomfort is both therapeutic and ensures safety. Offering water or ice chips, or checking with the surgeon, would violate the NPO order, potentially delaying or complicating surgery. Remember, clear, empathetic communication that upholds safety protocols is essential. Question 4. An LPN is reviewing the vital signs of a client admitted with dehydration. Which finding indicates the dehydration is improving? A. Heart rate decreases from 110 beats/min to 85 beats/min. B. Blood pressure decreases from 100/60 mmHg to 90/50 mmHg. C. Urine output decreases from 40 milliliters per hour to 20 milliliters per hour. D. Oral temperature increases from 99.8 degrees Fahrenheit 37.7 degrees Celsius to 100.2 degrees Fahrenheit 37.9 degrees Celsius. Answer A. Heart rate decreases from 110 beats/min to 85 beats/min. This question tests your ability to interpret vital signs in the context of fluid balance, a core concept in medical surgical nursing. The keyword improving helps you identify the positive change. In dehydration, the body compensates for decreased fluid volume by increasing heart rate to maintain cardiac output, so a decrease in heart rate towards a normal range indicates improved fluid volume. A decrease in blood pressure or urine output, or an increase in temperature, would suggest worsening dehydration or other complications. Remember that a return of vital signs to within normal limits is a key indicator of improvement in many conditions. Question 5. The LPN is reinforcing discharge teaching for a client with a new colostomy. Which instruction is most important for the LPN to emphasize? A. Change the ostomy bag daily to prevent odor. B. Empty the ostomy bag when it is 1/3 to 1/2 full. C. You will need to irrigate your colostomy every morning. D. Limit fluid intake to reduce ostomy output. Answer B. Empty the ostomy bag when it is 1/3 to 1/2 full. This question focuses on practical client education for ostomy care, a crucial aspect of promoting self-management. The keyword most important guides you to the priority instruction for colostomy management. Emptying the pouch when it is 1/3 to 1/2 full prevents it from becoming too heavy, which can pull on the skin barrier and cause leakage or skin irritation, and also reduces the risk of rupture. Daily bag changes are not typically necessary and can be costly. Irrigation is not always required for all colostomies, and limiting fluids can lead to dehydration. Proper pouch management is fundamental for comfort and skin integrity. Question 6. An LPN is providing care for a client who is agitated and attempting to pull out their intravenous 4 line. After exhausting de-escalation techniques, the nurse determines that restraints are necessary. What is the immediate action the LPN should take next? A. Apply the restraints to prevent injury. B. Obtain a physician's order for the restraints. C. Document the client's behavior and the need for restraints. D. Explain to the client why restraints are being applied. Answer A. Apply the restraints to prevent injury. This question assesses your understanding of safety measures and the appropriate sequence of actions when physical restraints are required, emphasizing immediate client safety. The phrase immediate action highlights the need for prompt intervention. In a situation where a client is actively pulling out in 4 line and agitation has not responded to de-escalation, the priority is to prevent immediate harm to the client. Restraints can be applied first to ensure safety, but a physician's order must be obtained as soon as possible, usually within 1 hour. Documentation and explanation are important but follow the immediate safety intervention. Always prioritize preventing injury to the client. Question 7. The LPN is caring for a client with type 2 diabetes mellitus who is scheduled for surgery. The client's blood glucose level is 250 milligrams per deciliter. Which action should the LPN anticipate? A. Administering a rapid-acting insulin dose. B. Holding all oral diabetic medications. C. Encouraging the client to eat a sugary snack. D. Preparing the client for immediate surgery. Answer B. Holding all oral diabetic medications. This question tests your knowledge of preoperative care for clients with diabetes, a key area of medical surgical nursing. The client's high blood glucose is important, but the keyword scheduled for surgery is crucial. Prior to surgery, oral diabetic medications, especially those that can cause hypoglycemia, are typically held to prevent complications like low blood sugar during or after the procedure when the client is NPO or has altered metabolic demands. While insulin might be administered, that decision is usually made by the RN or physician. Encouraging a sugary snack would worsen hyperglycemia, and immediate surgery would likely be postponed until blood sugar is better controlled. Question 8. An LPN is reinforcing teaching with a parent about preventing sudden infant death syndrome, SIDS. Which statement by the parent indicates a need for further teaching? A. My baby should always sleep on their back. B. I will keep soft blankets and toys out of the crib. C. It's okay for my baby to sleep in bed with me if they're fussy. D. I will ensure the crib mattress is firm and fits snugly. Answer, C. It's okay for my baby to sleep in bed with me if they're fussy. This question evaluates your understanding of safe infant sleep practices aimed at preventing SIDS, an essential concept in pediatric and maternal newborn nursing. The keyword need for further teaching indicates you are looking for an incorrect statement. Co-sleeping or bed sharing with an infant increases the risk of SIDS due to potential suffocation or entrapment, so this statement shows a critical knowledge gap. Placing an infant on their back, keeping the crib free of soft items, and using a firm, snug mattress are all correct and vital recommendations to reduce SIDS risk. Always emphasize a safe sleep environment for infants. Question 9. An LPN is contributing to the plan of care for a client with a new ostomy. Which nursing diagnosis is the highest priority? A. Risk for disturbed body image. B. Deficient knowledge regarding ostomy care. C. Impaired skin integrity related to ostomy effluent. D. Risk for social isolation. Answer, C. Impaired skin integrity related to ostomy effluent. This question assesses your ability to prioritize nursing diagnoses for a client with a new ostomy, an essential skill for developing effective care plans. The term highest priority directs you to the most immediate physical concern. Impaired skin integrity around the stoma due to irritating ostomy output, effluent, can lead to pain, infection, and difficulty with pouch adherence, which can quickly become a serious physical issue. While body image, knowledge deficit, and social isolation are important concerns, they are often addressed after immediate physical complications are managed or prevented. Protecting the peristomal skin is fundamental for comfort and preventing complications. Question 10. The LPN is assisting an older adult client who has difficulty hearing. Which communication technique is most effective? A. Speaking loudly and quickly. B. Shouting from across the room. C. Speaking slowly and clearly, facing the client. D. Using complex medical terminology. Answer, C. Speaking slowly and clearly, facing the client. This question tests your knowledge of therapeutic communication strategies, especially for clients with sensory deficits, a crucial skill in all nursing settings. The keyword most effective helps you identify the best approach. Speaking slowly, clearly, and facing the client allows them to better process sounds, read lips if possible, and pick up on nonverbal cues, making communication more effective. Speaking loudly and quickly can distort sounds, shouting is often ineffective and disrespectful, and complex medical terminology will only confuse the client. Remember that effective communication adapts to the client's needs to ensure understanding and build rapport. Question 11. An LPN is caring for a client who is complaining of new, severe abdominal pain. Which action should the LPN take first? A. Administer pain medication as ordered. B. Document the pain characteristics. C. Assess the client's vital signs and perform a focused abdominal assessment. D. Notify the healthcare provider of the new symptom. Answer C. Assess the client's vital signs and perform a focused abdominal assessment. This question evaluates your clinical judgment in prioritizing nursing actions when a client reports a new, significant symptom. The keyword first emphasizes the initial step in the nursing process. Before administering medication, documenting, or notifying, the LPN must gather more data to understand the severity and possible cause of the pain, which includes checking vital signs and performing a focused assessment of the abdomen. This assessment provides critical information to report accurately to the healthcare provider and helps determine the urgency and appropriate intervention. Always assess before you act or report to ensure you have a complete picture. Question 12. The LPN is preparing to insert a peripheral intravenous, catheter. Which action demonstrates adherence to standard precautions? A. Wearing sterile gloves during the procedure. B. Donning a gown and mask for the procedure. C. Performing hand hygiene and wearing non-sterile gloves. D. Administering prophylactic antibiotics before insertion. Answer C. Performing hand hygiene and wearing non-sterile gloves. This question assesses your understanding of standard precautions in infection control, a fundamental aspect of safe nursing practice. Standard precautions involve treating all bodily fluids as potentially infectious, and the keyword adherence signifies correct application. For insertion, hand hygiene followed by wearing clean, non-sterile gloves is the appropriate standard precaution to prevent the transmission of microorganisms. Sterile gloves, gowns, and masks are typically reserved for sterile procedures or droplet/airborne precautions, and prophylactic antibiotics are a medical treatment, not a standard precaution for insertion. Always prioritize hand hygiene and appropriate barrier protection for every client encounter. Question 13. An LPN is reinforcing teaching with a client about managing their newly prescribed warfarin, Coumadin, therapy at home. Which food or supplement should the LPN advise the client to avoid or consume consistently? A. Oranges. B. Green leafy vegetables. C. Chicken breast. D. Vitamin C supplements. Answer B. Green leafy vegetables. This question tests your knowledge of dietary considerations for clients on anticoagulant therapy, a crucial part of medication teaching. The critical concept here is that green leafy vegetables are high in vitamin K, which can interfere with the effectiveness of warfarin by promoting blood clotting. While clients don't need to eliminate these foods entirely, they should consume them consistently to maintain a stable INR, International Normalized Ratio, level. Oranges, chicken breast, and vitamin C supplements do not significantly interact with warfarin in this manner. Teach clients that consistency is key when consuming foods high in vitamin K to avoid fluctuations in their anticoagulant levels. Question 14. An LPN is caring for a client with a deep vein thrombosis, DVT, who is receiving heparin intravenously. The LPN observes oozing blood from the client's gums. What is the most appropriate action by the LPN? A. Increase the rate of the heparin infusion. B. Elevate the head of the bed to prevent aspiration. C. Apply pressure to the gums and notify the RN. D. Prepare to administer protamine sulfate. Answer C. Apply pressure to the gums and notify the RN. This question assesses your ability to recognize and respond to signs of anticoagulant overdose, a critical safety concern. The keywords oozing blood and heparin indicate a potential bleeding complication. Applying pressure to the bleeding site is an immediate first aid measure, and notifying the RN is crucial because the RN can assess the client further, check coagulation studies, like APTT, and collaborate with the provider for dose adjustment or antidote administration. Increasing heparin would worsen bleeding, elevating the head of the bed is not directly related to stopping the bleeding, and administering protamine sulfate requires a physician's order and RN assessment. Prioritize immediate safety measures and prompt communication with the RN for collaborative decision-making. Question 15. The LPN is assisting with the care of a client who has a nasogastric (NG) tube inserted for gastric decompression. Which finding indicates the NG tube is functioning effectively? A. Client reports increased abdominal distension. B. There is continuous suction applied to the tube. C. Gastric drainage is observed in the collection canister. D. Client complains of nausea. Answer: C. Gastric drainage is observed in the collection canister. This question tests your understanding of the purpose and function of a nasogastric tube for decompression, a common intervention in medical surgical nursing. The keyword functioning effectively refers to the tube performing its intended role. The primary purpose of gastric decompression is to remove gastric secretions and gas, so the presence of gastric drainage in the collection canister confirms that the tube is patent and successfully removing stomach contents. Increased abdominal distension or nausea would indicate the tube is not functioning effectively, and continuous suction alone doesn't guarantee effective decompression if no drainage is observed. Always confirm the therapeutic effect, not just the setup. Question 16. The LPN is assisting a client with ambulation for the first time after surgery. The client reports feeling dizzy and weak. What is the LPN's priority action? A. Continue walking to help the client regain strength. B. Have the client sit down immediately. C. Encourage the client to take deep breaths. D. Return the client to bed as quickly as possible. Answer: B. Have the client sit down immediately. This question assesses your prioritization skills related to client safety during mobility. The keywords dizzy and weak and priority action signal an immediate risk of a fall. The most important action is to prevent the client from falling by having them sit down immediately, or if a chair isn't available, gently lowering them to the floor. Continuing to walk would increase the fall risk. Deep breaths won't address the dizziness quickly enough to prevent a fall, and quickly returning to bed might also lead to a fall. Always prioritize client safety by taking immediate action to prevent injury during mobility issues. Question 17. An LPN is reinforcing teaching about fall prevention strategies with an older adult client in their home. Which statement by the client indicates effective understanding? A. I will keep my throw rugs in place because they are decorative. B. I will wear my slippers even if they are loose. C. I will make sure my pathways are clear and well lit. D. I will avoid using handrails on stairs to improve my balance. Answer: C. I will make sure my pathways are clear and well lit. This question evaluates your understanding of environmental safety and fall prevention, crucial for client education and coordinated care. The phrase effective understanding means you are looking for the correct statement. Clear and well-lit pathways reduce tripping hazards and improve visibility, significantly decreasing the risk of falls. Throw rugs, loose footwear, and avoiding handrails all increase the risk of falls in the home environment. Always emphasize removing obstacles and ensuring adequate lighting to promote client safety at home. Question 18. An LPN is caring for a client with a new prescription for penicillin. Which finding in the client's medical history should the LPN report to the RN before administering the medication? A. History of seasonal allergies. B. Reports of occasional heartburn. C. Client states they broke out in a rash after taking amoxicillin last year. D. Client takes a daily multivitamin. Answer: C. Client states they broke out in a rash after taking amoxicillin last year. This question tests your awareness of medication allergies, a critical safety check before administering any drug. The keyword report indicates a significant finding, and the information about a rash after taking amoxicillin is the key clue. Amoxicillin is a penicillin class antibiotic, and a previous allergic reaction to one penicillin indicates a high likelihood of an allergic reaction to another, including penicillin itself. Seasonal allergies, heartburn, or multivitamin use are generally not contraindications or immediate concerns for penicillin administration. Always prioritize verifying drug allergies, especially to medications in the same class, to prevent potentially life-threatening reactions. Question 19. An LPN is observing a client with diabetes mellitus demonstrating self-administration of insulin. The client draws up the correct dose but forgets to clean the injection site with an alcohol swab. What is the most appropriate action by the LPN? A. Correct the client's technique immediately and have them repeat it. B. Administer the insulin for the client to ensure proper technique. C. Document the error and report it to the RN later. D. Allow the client to proceed and provide feedback after the injection. Answer: A. Correct the client's technique immediately and have them repeat it. This question evaluates your role in client education and safety during skill demonstration. The situation involves an observable error in a critical self-care skill, insulin injection. The most appropriate action is to immediately intervene and correct the technique to ensure client safety and prevent infection at the injection site. Allowing them to proceed would risk infection, administering it for them doesn't teach them the correct way, and simply documenting or reporting later misses an opportunity for immediate correction and learning. Always provide timely, constructive feedback during skill demonstration to reinforce proper technique and client safety. Question 20. The LPN is preparing to administer eye drops to a client. Which action is appropriate to ensure proper absorption of the medication? A. Apply the drops directly to the cornea. B. Instruct the client to blink rapidly after administration. C. Place the drops into the conjunctival sac. D. Administer the drops immediately after the client applies eye makeup. Answer: C. Place the drops into the conjunctival sac. This question assesses your knowledge of proper eye drop administration technique, a practical nursing skill. The phrase proper absorption indicates the correct method for the medication to be effective. Eye drops should be administered into the lower conjunctival sac, which is the pocket formed by pulling down the lower eyelid, because this area can hold the medication without it immediately spilling out or irritating the sensitive cornea. Applying directly to the cornea is painful and can cause injury. Rapid blinking can push the medication out, and eye makeup should be applied after eye drops, not before. Proper technique ensures both effectiveness and client comfort. Question 21. An LPN is caring for a client who reports severe pain after a surgical procedure. The client is restless and grimacing. The LPN notes the client's pain rating is 8 on a scale of 0 to 10. What is the LPN's best initial action? A. Document the pain rating in the chart. B. Offer the client a comfort measure like repositioning. C. Administer the prescribed PRN opioid analgesic. D. Call the healthcare provider to report uncontrolled pain. Answer: C. Administer the prescribed PRN opioid analgesic. This question tests your clinical judgment in pain management and prioritization. The keywords severe pain, restless and grimacing, and 8 out of 10 all indicate acute, high-level pain that requires immediate intervention. If a PRN, as needed, opioid analgesic is prescribed for this level of pain, administering it is the most appropriate initial action to provide relief. While documentation, repositioning, and calling the provider are important, they are not the primary initial response when a client is in severe, actionable pain for which a medication is already ordered. Always prioritize administering prescribed pain relief for acute, severe pain. Question 22. The LPN is caring for a client who is receiving continuous oxygen therapy via nasal cannula at 4 liters per minute. Which finding requires immediate intervention by the LPN? A. The client's oxygen saturation is 94%. B. The client reports dryness in their nasal passages. C. The nasal cannula tubing is kinked, and the client's lips are bluish. D. The humidifier bottle is half full of sterile water. Answer: C. The nasal cannula tubing is kinked, and the client's lips are bluish. This question assesses your ability to identify life-threatening situations related to oxygen therapy, a critical aspect of respiratory care. The keywords immediate intervention and bluish lips, cyanosis, indicate a medical emergency where the client is not receiving adequate oxygen. A kinked tube prevents oxygen delivery, and cyanosis is a direct sign of hypoxia. While nasal dryness is a common side effect, 94% oxygen saturation is generally acceptable, and a half-full humidifier bottle is not an immediate crisis. A client turning blue requires urgent action to restore oxygen flow. Always prioritize immediate threats to airway and breathing. Question 23. An LPN is reinforcing teaching with a client newly diagnosed with hypertension about lifestyle modifications. Which statement by the client indicates a need for further instruction? A. I should try to eat foods low in sodium. B. Regular exercise can help lower my blood pressure. C. It's okay to continue my usual alcohol intake. D. Maintaining a healthy weight is important. Answer: C. It's okay to continue my usual alcohol intake. This question evaluates your understanding of lifestyle modifications for hypertension, a core concept in chronic disease management and client education. The phrase, need for further instruction, indicates you are looking for an incorrect statement. Excessive alcohol intake can raise blood pressure and interfere with antihypertensive medications, so this statement requires correction. Eating low-sodium foods, engaging in regular exercise, and maintaining a healthy weight are all crucial and correct lifestyle modifications for managing hypertension. Always clarify misconceptions about habits that can negatively impact health conditions. Question 24. The LPN is providing care for a client with a stage 2 pressure injury on the sacrum. Which finding would the LPN expect to observe? A. Intact skin with non-blanchable redness. B. Full-thickness skin loss with exposed bone. C. Partial thickness loss of dermis, presenting as a shallow open ulcer with a red-pink wound bed. D. Full-thickness tissue loss with slough and/or eschar covering the wound bed. Answer: C. Partial thickness loss of dermis, presenting as a shallow open ulcer with a red-pink wound bed. This question tests your knowledge of pressure injury staging, an important skill for wound assessment and documentation. The specific stage, stage 2, is the key identifier. A stage 2 pressure injury is characterized by partial thickness skin loss involving the epidermis and/or dermis, presenting as a shallow open ulcer with a red-pink wound bed, or an intact or ruptured serum-filled blister. Intact skin with non-blanchable redness describes stage 1, exposed bone indicates stage 4, and slough/eschar covering the wound bed describes an unstageable pressure injury. Understanding accurate staging is crucial for appropriate wound care and communication. Question 25. The LPN is assisting with the care of a client receiving a blood transfusion. 5 minutes into the transfusion, the client reports feeling chills and has lower back pain. What is the LPN's immediate priority action? A. Increase the transfusion rate to infuse it faster. B. Recheck the client's vital signs and continue to monitor. C. Stop the transfusion immediately. D. Notify the healthcare provider. Answer: C. Stop the transfusion immediately. This question assesses your critical thinking and rapid response in a potentially life-threatening situation. The keywords chills, lower back pain, 5 minutes into transfusion, and immediate priority action strongly suggest an acute hemolytic transfusion reaction, which is a severe and potentially fatal complication. The absolute priority is to immediately stop the blood transfusion to prevent further reaction. While vital signs need to be rechecked and the provider notified, these actions occur after stopping the infusion. Increasing the rate would be extremely dangerous. Always prioritize stopping the infusion at the first sign of an adverse reaction.